Making it mandatory, long-term care staff, support workers, students, and volunteers need to be vaccinated for COVID-19 by November 15th.
To provide residents and staff the greatest level of protection possible.
Long-term care Minister Rod Phillips says staff immunization rates at the province's 626 long-term care homes varies widely, with more than half reporting a rate of less than 90% and about 100 reporting a rate of less than 80%. Numbers that he says are not good enough.
As new variants continue to spread, the risk to those most vulnerable remains high.
The government has also decided to publicly post the vaccination rates for each long-term care home. Grace Villa, the site of Hamilton's deadliest COVID outbreak where 44 people died, has the worst rate in the city, with only 67% of staff fully vaccinated. Some long-term care companies are already implementing mandatory vaccination policies for their staff. Unger Homes, which owns Hampton Terrace here in Burlington, announced recently that its mandatory staff vaccination policy will be effective starting today. Hampton Terrace has the largest open outbreak in Halton, with 34 cases listed, but the home's administrator, Karen Verhage, says none of the cases are active, and she expects the outbreak to be called off next week. She wouldn't go on camera, but says the mandatory vaccination policy was rolled out to keep everyone inside safe. Verhage says that of her more than 110 staff, 5 members resigned as a result. She called today's announcement fantastic and long overdue.
The main source of the continued outbreaks has indeed been unvaccinated staff, and he did admit that.
Long-term care advocate Vivian Stamatopoulos says Rod Phillips' decision to target unvaccinated staff is the right approach, and says making the vaccination rates public will result in greater staff uptake at homes.
Because then people like me can go and make sure that the homes that are not doing well get some public pressure to do better.
It's really welcome, especially with the mandatory posting for the home-by-home data today. We felt that you couldn't do one without the other.
Donna Duncan, the CEO of the Ontario Long-Term Care Association, also welcomed the news, but lamented that the mandate doesn't apply to all healthcare workers.
We are disappointed that it's not a full health system-wide mandate.
SEIU Healthcare, which is a union, also applauded the mandate, saying the majority of its members support it as a matter of workplace safety. Matt Ingram, CHCH News.